nature-identical peptides derived from the Caribbean blue scorpion venom. So, in a nutshell, what are we trying to achieve? What's the goal? What's the objective? So, we're going to be taking this venom sourced from scorpion, and utilizing a proprietary chemistry, we're going to separate and sequence the peptides within that. And then the whole objective is then to move to large-scale automated synthesis so that we can generate in a synthetic fashion, using that proprietary chemistry, a whole series of nature-identical peptides and variants thereof. So hopefully that gives you an overall scope. So this is going to be addressed over 3 stages. The first stage, as I've already mentioned, will be milking that venom, and thankfully that's not my job. We will then be looking to separate the various constituents within that venom, and we'll first do that according to the size of those peptides. So the smaller ones will travel much faster in this gel, and then we will also separate them according to their charge. And then we will take each of these profile dots that are generated in our gel, and then we will analyze them to give us our single first native peptide. And then comes the job of sequencing it, and we'll be using latest state-of-the-art sequencing technology. And how that works in a nutshell is it takes a given peptide and it uses these scissors, hypothetical scissors, and it clips off one of those building blocks at a time. As Mac explained earlier, a peptide is made up of loads of amino acids, could be up to 35 to 40, and this sequencer will clip one amino acid at a time. And by doing that, the actual component that falls off is analyzed, and then we detect which of the amino acids that is. And we do that in a sequential fashion until we get to the end of the peptide. And by the end of that, we have a blueprint for that given peptide. And we repeat that procedure for all of the peptides which we're going to be isolating. The next stage will take us to the proprietary chemistry element, where we will then, using in silico methods, we will generate peptide variants based upon those natural sequences, where we retain the active segments and structures of those peptides, and using that proprietary chemistry to introduce those active and also stabilizing these peptides. Because we all know that one of the bottlenecks to peptide delivery is in terms of their stability. And so we'll be working in doing that in parallel as well. So the key goals are to generate the proprietary nature-identical peptides. And one of the bottlenecks to opening up peptides as therapeutics is in their stability. And we'll be engineering into those peptides innate stability in the in vivo system as well. And the bottom line there is that we want a longer duration of action so that the peptide can act for a lot longer, but we're also looking at other modes of delivery, so we could potentially also look at oral delivery as well. And that will then provide us candidates to move into stage 3, which will be where we will screen those peptides in disease models. This will also be done at PACE, where I'm based, with one of my colleagues who's a world expert in angiogenesis and tumor metastases, formerly from the Cleveland Clinic in Ohio. So we'll be taking those nature-identical peptides, screening them in a range of different brain cancer models, and we'll be looking for key changes in specific biomarkers which are indications of the disease. And the key attributes we'll be looking for in terms of the information generated from those screens will be how effective are they in the disease progression, so those tumor cells continuing to grow, and how do we alter or not the invasion potential of those cells, and in terms of treatment, are they going to help us to be a potential candidate for treatment? So we'll be screening them in that fashion. And so I suppose the question you're asking is that in terms of the proprietary chemistry, what proof of concept do we have moving forward? Well, in parallel, over the last 2 or 3 years, I've been working with one of my leading colleagues in the school who's an expert for the last 25 years in pain and inflammation. And so when we experience an injury, our brain releases a series of molecules, also are peptides invariably, and that gives us effective pain-killing properties. And so there's been a lot of work done on characterizing those peptides. It's widely reported in the literature. And they have great activity in those cell-based models, but they're absolutely rubbish drugs because they're digested within seconds to minutes. And so I took it upon myself to say, okay, well, why don't you give me the sequences of those peptides and let me play around with them. And that's what we did. We redesigned and then we resynthesized those native peptides that our brains, human brains, release, and using this proprietary chemistry. And then I sent them back down to level 6 to my colleague's lab and said, look, here's a library of them, just throw them in your assays when you're next doing them, and if you get anything back, let me know. A couple of weeks later, he came knocking on my door, literally knocking it down and saying, Harry, what the hell was in those samples? And I said, well, first you tell me the data, but what have you got? Have you got something promising? You're just pulling my leg. And he said, well, what we found is that they're equipotent, and there's some of the candidates which are even superior to the natives. And that's unheard of, because when you're talking about native peptides, if you start altering any of those sequences, in all of his experience, 20, 25 years working in the pain and inflammation space, you literally abolish activity. So he was really surprised, and we were very encouraged that this technology was able to deliver this. And so we now have candidates which are proprietary, they are stable constructs, and they provide us with novel lead candidates. And so taking this proof of concept, we will be translating that into the nature identical peptide work.